Okay. Hello, 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 everybody. We are live, and thank you for joining us. Those of you who have or who will in the future join us, thank you for watching. And this is a continuation of the Impact series that I started last month. Everybody, just make sure you mute yourself when you're not speaking, please. Hello.
Hello.
So, just to recap, this is the Impact series. Last month, I started this series, and then I ended up getting sick, so I was unable to finish the series out for September. But we are continuing. The show must go on, and this is part two to a four, I think it's 5-part series actually. And this is the mental health conversation, something that touches every sickle cell patient, whether you want to admit it or not. Uh, with that being said, I'm just going to introduce myself so that my lovely panelists could then introduce themselves and we can start the conversation. Hi, everyone. For those of you who do not know me, I am Shay Breon Howard, aka Shay the Advocate, aka Chef Shay Made It. And I am a filmmaker, photographer, author. I'm also um, an advocate, speaker, mental health advocate as well, public speaker, and I have a almost 12-year-old sickle cell trait warrior. So I have been a advocate for going on 9 years now. It's been a while. So I'm excited to just bring you guys this series and see how this conversation goes. And Miss Felicia, Dr. Felicia Hunt, will you please introduce yourself?
Yes. Hello, everyone. Thank you, Shabrian. I'm glad to be here. As she said, I am Dr. Felicia Hunt. I'm a doctor of psychology, a certified sex coach, an author myself. I have SS. I have an adult son who has the trait and also diagnosed with schizophrenia. Um, I've been in the sickle cell community for a while, and right now I'm working on building a nonprofit focusing on warriors 50 and over. So, looking forward to that. Our first fundraiser event will be November the 4th. So, looking forward to that and planning that right now. So, glad to be here to talk about mental health um, because it is work. It is work. And I pass it on to the next guest.
Master,
Can't hear you.
you want to introduce yourself?
I had muted myself.
Come on,
Yeah.
Lord.
I'm mental health, and let me see. I'm a self advocate, um, um, parent, uh, philanthropist. No, I'm just joking. Yeah, that's all. That's my introduction. That's it. That's all. On to the next guy.
Okay, Nathaniel, would you introduce yourself, please?
Uh, my name is Nathaniel. I have sickle cell. I'm just here.
All right.
I don't really know what I'm supposed to say, but yeah, there we go.
Well, that's perfectly fine. Okay, so before we get started, I kind of want to um I would like to go over the survey, mental health portion of the survey that I put out last month. So we're just gonna go over that and give our response from there. Okay?
Okay.
Okay.
All right, let me go ahead. Oops. Okay. Convictions, property, and impact. Okay. I, I have it here. I'll just pull it up here. And Marlene has joined us as well. As soon as her camera is on, I will add her to the live. But for now, sickle cell. Let's see. Okay, there we go. I was having a hard time pulling it up on my uh, okay, there we go. Okay, so let's go down to the mental health questions. So the first question is, how often does living with sickle cell affect your mental health? The answers were daily. 28.6% of the people who responded to the survey said daily. 28.6% said weekly. 28.6 said occasionally, and 14.3% said never. Okay, the next question is, do you have okay, she's on. All right. Um you just got to flip your camera, Marlene, and I could bring you up. The next question is, do you have access to mental health support, i.e., therapy, counseling, or peer groups? And 42.9% of people said yes easily. 28.6% said yes but limited. 14.3% said no, not available. And another 14.3% said no, too expensive. Okay. And the next question is, what are your biggest mental health challenges related to sickle cell? And this is an open ended response question. So I'm going to give the responses that I have, which is anxiety, a lot of fear of how long will I live? Will I get to raise my daughter and to see her become an adult before I go? Will people treat me with respect and stop treating me bad because I don't feel good to work today? Will I get fired for being hospitalized for a week? So many worries, including, will I lose all the hard work because of sickle cell anemia? And then we have always being prepared for a pain crisis anytime, anywhere. Other warriors not having tools, keeping a positive mindset when in pain and having to put life on hold, trying to rest, but a million things to do. That's that, that sounds like something I would have said. um, that we can't do a lot of dealing with sickle cell. Okay, uh, depression and feeling unworthiness. Those were all of the answers for that specific question. And then we have what kind of mental health support would be most helpful for you? This again was open ended. Okay, we could bring Marlene in. Let's bring her up. Hello, Marlene. How are you? Can you hear us?
Hello. Now I can finally hear.
Hi.
Hi, how is everyone?
Good.
Pretty good. You want to introduce yourself really quick before I finish the
Um,
response for the.
okay, I'm Marlene Ross. I'm also a sickle cell warrior. I'm located in California. I'm a preschool teacher, a nanny. I do a little bit of everything, modeling, acting, in the process of writing a children's book, and also have a business called Spoil Pleasures for all your relaxation needs.
That's what's up.
Okay, thank you so much for introducing yourself. So right now I'm just reviewing the
That's,
survey
that's gonna be my
questions,
business
the
partner.
specific. Huh?
I said that's gonna be my business partner.
I can't even see.
Oh, really?
Oh,
Okay.
hi,
Hey,
Felicia!
girl.
Wait, Dr. Felicia.
Yes.
Yes.
How are you?
Good. I just texted you today for a meeting.
You text me.
I did. Well, we can talk about that later.
Okay, I get out text.
Okay.
Okay, yes, we'll talk about that later.
Okay, guys. So there's only one last question for this Pacific. Did I say Pacific? Wow.
That's
Okay. This
you got yourself.
specific, this specific portion of the survey. There's only one last question for the mental health portion, which is what kind of mental health support would be most helpful to you, and it's open ended. We have responses. One is maybe meditation classes, therapy, real support and answers for holistic mental health practices, a group panel of SC warriors together over a counselor to talk to one another, real peer support therapy. Okay. Checking in, online therapy, Christian counseling. So
Hmm.
that is all of the responses for that specific section. Does anyone have anything they want to say towards what they just heard?
Well, I can definitely personally, not just as a doctor, but personally relate to some of the responses. Um,
Hmm.
some of the background noise is kind of distracting. I'm sorry. If you guys can mute before, before you talk, unmute yourselves. All right. Um, so, listening to, whether the statistic says daily, weekly, you know, monthly, not sure, or whatever, I guarantee whether you recognize it or not, because sometimes we have behaviors that we don't think is contributed to mental health. You might think, oh, that's just the way I am, but sometimes it's not the way you are. Sometimes it's the way you are coping, the coping mechanisms you are using that may feel very comfortable, but they're not, effective. And you have to seek help in order to really understand if any of the things that you're doing is really sufficient or helping. And I know that because I had to do my own therapy. I had to get therapy for myself. I was ready for it and, just ready to go over some things in my life to get some clear understanding just as a human being, not just a person who lived with sickle cell, but just as a woman, a human being, and all the other different things that we go through as well, besides sickle cell. We have a whole human life, you know what I mean? That we have all kinds of different experiences and stuff. And so, I've learned a lot, and I'm hoping today that I'll be able to give some, edification on what it really takes to have good mental health, and I call it mental fitness. And, we'll get into that as we continue to go. But I'm going to say now that there is a definite way to change your mental health issues into mental fitness, where you can be mentally fit to designate your life the way you want it to be. Yeah, just unmute yourselves when you talk.
I was talking. I know I was talking.
Going through.
I was
I see
all
your
with
mic
you on there
open.
though. I definitely understand. There's
Yeah, I was all
there's
talking. I'm like, okay, unmute yourself so I can speak. Ah, very good.
right. I think we all forgot that we were on mute. We just
Very good.
but yeah, if anyone else wants to speak up, I definitely like agree though, because when I lived in El Paso, I dealt with my anxiety was way worse. And there were times where it was almost like crippling sometimes. Like I would go to the store and have these really bad panic attacks that at, at first I thought they were because I have asthma, right? I thought it was asthma attack. And so I'm hitting the inhaler and I'm like, that ain't doing nothing. What's going on? And it was the I was having a panic attack. And so with those situations, I had to learn tools to ground myself, back to me. And when I would do that, you just look for, my tips were is just basically like look at different things around you and name it and just slow your breathing and just, be in the presence of yourself basically. And so that really helped me in those moments. I had to learn tools because like I said, I thought I was having an asthma attack. Health problems, you like you said, it might present itself as something that you've already dealt with that has nothing to do with your mental health, but it really is your mental health that is the problem most of those times. So anyone else have anything they want to add before we move on?
I agree with everything that was listed. I would also add, if it wasn't mentioned, like journaling, writing. Um, I know meditation was mentioned. Also, a form of that mental health for me would be doing things that I enjoy, that relax my body. Maybe taking a bath, something like that.
Mm, yeah. All
I,
great tools. You're right. Yeah.
I think people with sickle cell actually counseling each other would really be helpful because it's very lonely having a disease that most people don't understand or don't want to hear because they don't think that it's what you say it is. So like even with counseling, I've been through counseling and A lot of therapists don't get it. They think that you're just whining about being sick when it's not whining when my whole life is affected by something that I can't control. Like I've been fired from jobs for being sick and so on and so forth and all kinds of just other things in life. Raising children with sickle cell, missing out on things because you're always in the hospital. It's a lot to try to convey to somebody who has no understanding of that. So I just think we would be better as a community if we communicated better with each other.
Well, if I can interject on that real quick,
You're absolutely right. You're
yes,
right.
he is absolutely right. Um, I want to say that Presence has a study that they're doing. And if you are in the ages, I believe, of, I think it starts at 16 and I think it cuts off at 35 or 40. Um, it's for sickle cell warriors. And they do have coaches in this program, health coaches, that when you are a part or participating in their research, you do get that counseling part with someone who truly understand what sickle cell is all about. Okay, so if you want to partake in that study, it's called Presence, just like it's spelled, just like it sound, Presence, all caps. You can look it up. It's been created by Dr. Charles Jonasset. I don't know if I'm saying his last name right, but Charles Jonas said. And right now, Dr. Kadeem is the one who is in charge of our CAB meetings and everything like that that we have. But they are running this study right now, and it's called Presence, and it's dealing with cognitive behavioral therapy and some other things that they're looking at, to just, find out what the sickle cell community and what works with the sickle cell community in terms of dealing with their sickle cell and how some of these therapies can help them. So you will be helping out them do the research, and at the same time you will be getting help with whatever else you're dealing with in your everyday life as a sickle cell warrior. So that's something you can check into as well.
How can we find this survey?
Um, so what it is that you apply or you register to be a part of it, and if you're selected, then they will give you everything that you need. But right now, just look up presence, and then from there, you should be able to find out the next steps on what is, you know, needed to be done to be a part of that study. Back to you, Shabrian.
Okay, awesome. And if you have the link, either you can send it to me or,
Yeah, yeah,
put it in the comments in the
yeah.
video so that people might look it up and go ahead and figure
Most
out,
definitely.
if this is something that they're interested in doing. Now,
Mhm.
I'm going to move on to the actual discussion part of the conversation for us. Okay. Now, this portion is about personal experience and lived reality. So, how has living with sickle cell disease impacted your mental and emotional well being over the years? Anybody want to answer that question?
I guess I'll go first. Hi,
Okay.
for those that are joining in, my name is Marlene Ross. And to answer the question, living with sickle cell has impacted my mental and emotional health, but it has also like tested me in ways that has built my strength. Um, like for example, constantly being in pain. Like I have chronic back pain. I wake up in back pain every day. Regardless if it's like we do a pain scale, 1 through 10, regardless if it's a pain of a one, which it rarely is. Generally, my pain is generally about a 3 at the lowest in my back. And it can range all the way to 10, 10 being the worst amount of pain. But having to deal with constant pain on a daily basis, multiple hospital stays, and anxiety, what we've talked about, mental health, depression. I'm pretty sure a lot of warriors have experienced that just as well as I have. But it's also taught me resilience. Like I've learned to celebrate my small wins, my victories, like starting my candle business, in the process of writing a children's book about sickle cell, and being more of an advocate for those who have sickle cell and bringing more awareness out there. Um, so basically, to end with that, just really celebrating everything that's small, the smallest thing, celebrate it, just to bring you mental peace, because we're not going to wake up as a sickle cell warrior. We don't wake up every day and like, oh, I'm energized, I'm ready to go. It doesn't, for our bodies. We barely get to experience that. So celebrate the small ones. And I'm done.
You're absolutely right, Marlene. Like, it's, you have to celebrate the small things. Anything that it might be small to you. Sometimes the anytime I'm able to get out of the bed, okay, and do anything, I'm happy. It may be painful, it may be hard, but I'm doing it. There are times, the times are that I feel that are worse for me is when I can't do anything at all. And when I'm stuck in the bed. That's, you know, for me, my lowest points of having sickle cell. So anything where I'm out of the bed and I'm moving around, even if it's for a little bit, even if it's to go, into my kitchen and make me something to eat or whatever the case is, that's a small victory that, I celebrate, because all of these issues that comes my way, you have to have joy. You have to find the joy in life, and not focus on the negative part of having sickle cell. And there are I don't want to misspeak on what she calls them, but Nita has this phrase, when you're able and you're feeling good and you go and you do, say, me and my daughter, we do mini daughter dates, stuff like that, and we go places. Those are the times where, you have the most fun, and you can look back on those times when you're not feeling well and think about how much fun you had, how much light and, joy you had in those moments, to bring you out of that darkness as well. I find that that helps as well when you look at stuff in that, perspective of things. When I am in the hospital, I don't have to think about, oh, I'm here and it sucks. And, I can think about, oh man, a few weeks ago or a month ago or however long, me and my daughter did this. And I'll go back and I look at pictures or videos, and it just brings me joy on the times that I feel, I need it the most. So those are also ways to, you know,
Yeah.
bring some sort of normalcy to this craziness. Anybody else have anything they want to add before we move on?
I think, like when I was pretty much my whole life, I walked around telling myself to be happy because everything's okay. You woke up, everything's okay. You're not in the hospital, everything's okay. It's all good. It's all good. I'm 46 now, and now it's been getting a little bit harder because I'm tired. you know. So now it's like I gotta do mental gymnastics to tell myself everything's okay. You good. They just found this thing wrong with you. It's fine. You're good. You're still alive. You just got out of ICU. Cool. You okay? You made it. You're fine. And that is that is the part that people don't see, I guess. You know, like it's the
It's never
I'm,
ending, seem like. It's always something.
exactly. That's that, and it's like I'm just tired, and I don't want to sound like I'm giving up because
No,
I'm not giving
right,
up. It's just
right.
tired.
I get what you're saying. Yeah.
You know? So
And that's what I was gonna talk about. Like now I'll be 59 this year. And it's in stages because when I was younger, dealing with it, I was discovering what sickle cell was about just for myself. I didn't know. I get diagnosed. I looked at my mom. She don't know. She didn't. My mom and dad didn't know they were carrying the trait. So I got the disease. I'm the only child that got the disease. And so, it was a discovering period. And so discovering, all these different things I would be going through. And then, okay, now I understand what I'm going through. Now, maybe I'm a teenager and I'm going through things. And now I'm seeing, oh, it's based on things that I might be involved in. It don't even have to do with maybe the weather or anything like that. Now I'm understanding, okay, stress got something to do with it. I'm learning. You learn these different things, like, okay, I can't get too happy, I can't get too sad. If I do that, I get sick. You know what I mean? So it's like all these different things. And now that I'm going to be 59, I'm done with sickle cell. I'm just done. That's what I tell myself. I'm done. Sickle cell is not going to rule my life anymore. It's like I understand, for me, I feel like I understand how this thing works and what gets me upset. And if I feel like if I could just build the mental fitness that I'm talking about, I would be okay. Because I think this is the thing, though, however. I think sometimes we get too caught up with what other people think, our parents, our friends, our family, and then we don't know how to listen to the true voice inside of us that tells us exactly what we need to know about us, and follow it and believe it and understand it and do what it is that you need to do, exactly what that mind tell you. Because sometimes you find yourself saying, I thought about that and I should have did it, but I didn't, right? And it's like, but I did this and now I'm sick and now if I would have listened to myself, right, I would have. And sometimes we find ourselves going through those things. And so I'm just going to segue here at this point, because I did explain to Shabrion that I do have another talk to go to after this. But I do want to tell you guys that my book is finally coming out. Okay. And this book is for everyone, whether you have sickle cell or not. It's a self help book, and it's called Liberating Your Sex, A Journey to Your Authentic Life. And you might think, well, what do that have to do with mental health and sickle cell? It has a lot to do with it, because if you don't know who you are, if you don't truly understand that power within, I don't believe there's anything you can do in your whole entire life without understanding that. To bring yourself peace, to bring yourself joy, to bring yourself happiness, to bring yourself to all the things that your heart desire, you first need to know who you are and how that applies to everyday operations, to making sure that you achieve your goals. And so it's a 7-step process book with meditation and scriptures and everything that can support you on your journey to discovering how to live an authentic life without listening to someone else's voice, to really hone in to your own voice, to the God-given voice, to the God-given power that God has given us, all right, on this earth to be. And so I'm really excited about that, to be able to launch this book and the workbook and everything else that's going to be coming with it, so that people can begin to empower themselves and take control over your lives in terms of your health, your mental health, physical, spiritual, mental, body, everything. So I hope you will enjoy it and support me in it. And I think it would do the sickle cell warrior family a good, piece of work to have in your hand to any time. It has the journaling aspect to it and everything, meditations that you can do, plenty of ritual exercises that you can do to build that mental fitness, because it's a work, it's not overnight, and you have to see your progress over time. So I just want to leave you guys with that. And I'm hoping that everyone just take care of yourself and trust your intuition. You're on the right track, and you don't have to feel um, the tiredness that you talk about. You don't have to feel that anymore, because you can definitely know that what you're doing and how you're thinking with mental fitness is the right thinking. And that's what we have to get to, understanding that and being very unapologetic about that, what works for you, and understanding that and standing on it. And it's okay to be there. And that's what I really want to empower warriors to understand, that you have the power to control your destiny and your future and how it looks, and however way you want it, you can design it to be that way, and be healthy about it. I'm not saying that every day is a piece of cake, because every day for me is not a piece of cake, but with the mental fitness that I have, I can get through it, and I can stay positive, and I can stay with a good attitude, because that is what brings about my outcome, and it can do the same for you. And I'm just sharing with everybody what works for me. So thank you for this time, Shay Brian. I have to get to my next meeting, and I so appreciate you bringing me on today for this. And I look forward to being on again with you guys later. And my business partner, I will be in touch with you, Miss Rose. We got some things to talk about. So,
Yes. Talk to you soon.
all righty. So, thank you guys for having me, and continue to
Thank
have a
you for
good
coming.
platform. And if anybody have any questions for me, Shay Brian, just let me know, and I can come back. We can come back and answer them at another time. Okay.
Okay, sounds good. Thank you for joining.
All
I
right.
appreciate you.
Thank you. All right. Bye bye,
Have a
everyone.
good one.
Yeah. Bye bye.
Bye. All right, you guys. So, moving on to the next question. What are some of the unique psychological challenges that people with sickle cell face compared to those with other chronic illness? I'm sorry. Yeah, illnesses. I had to double check. Does anyone want to answer that?
Say that again.
Say it again.
Okay.
I
What
would
are
say,
some of
oh,
the Just one second, let me ask the question one more time. They didn't hear me. What are some of the unique psychological challenges that people with sickle cell face compared to those with other chronic illnesses?
my answer would be um, the chronic pain in general, and how pain could come on regardless of what we do or not. Like, I could have a very chill day, be resting in bed, wake up perfectly fine, and then by the end of the day or midday, have a complete blown on full pain crisis. So a lot of people misunderstand, like, how could you were just well a few minutes ago, and now all of a sudden you're in a high amount of pain to where you have to go to the hospital.
Yeah.
um so I think that's one thing. And then sometimes for me, isolation, sometimes I feel guilt or fear of like being a burden to my family or friends. Like, that took me a while. For a while, I 'cause all my family, they're just super busy. So there would be times like I would just be at home, just in pain and not wanting to worry anybody or try and take care of myself. And then all of a sudden, I'm calling my mom or my sisters and telling them, hey, I got to go to the hospital. And they're like, how long have you been in pain? What's going on? And here I am updating. Well, why didn't you tell us ahead of time? What? But that, um, and then also the stigma when we go to the hospital. Those are things that we face. It's a little bit of everything.
Yeah.
Yeah,
Yeah,
I got like for me as a man who I feel like I should take care of everything. As I'm getting older, my body doesn't allow me to take care of a lot of things, and it's starting to that really be driving me crazy because I'm so used to being self-sufficient. I don't want to ask people for help. I don't want people doing things for me. I want to do everything on my own, and it sucks when your body says, "Well, if you don't sit your stupid down, you're not doing that today. It's not happening." And also, people not understanding. It's really tough trying to talk to, and I'm talking, when I say people not understand, I'm talking about the people closest to you that know. Like, I got diagnosed with sickle cell when I was 3 months. I can't tell you a day of being normal in this life. And everybody I grew up with knows what I went through, like my brothers. But trying to get people to understand what you're going through, even though they watched you live it and go through it, it's weird to me that they don't understand it. But they don't. And that kind of stresses me out.
I agree.
Master, you want to answer that
Yeah.
question? You have any input?
Uh, I don't know what other people go through. Uh, to separate what we may deal with versus what they may deal with. Um, so, but what Nathaniel just said, I recently experienced, a person speaking on. I think I told you about this when I was talking about the painting that I was coming up with the concept of, and it was like, when people who just started experiencing pain or been experiencing pain for the past 10 years, 20 years, whatever it is, they weren't born this way. I think that's something that I do know, right? But like other illnesses, I don't really know. But people who new to pain, it's almost like they try to make y'all they almost like they try to make y'all experiences like be the same, and it's not. It's the difference between a person who uh, has had the liberty to walk around just regular versus a person that don't know what regular feels like. And as you get older with this, like now people ask you like, oh well, you're gonna get the stem cell thing and all that, and it's like, nah, I don't know nothing but this. And here's the thing, right? I be trying to explain to people like y'all might not even want to see me without this. Like this probably keep me like chill. This make me kind of have feelings for people, and That's I'm real. just for a woman, and then I mean like people. You know what I'm saying? This make me have some remorse.
Crash off our phone. I feel
I
you.
never thought about it like that. Hmm.
And so like I say I think that as you live with something forever, it's a total difference between people who don't, but they always try to tie yourself to. You know what's crazy? It's like it's like people, and I even mean like other races. It's always
Oh,
Oh, we lost him. He'll be back.
his camera crashed out.
Um, yeah, but no, I definitely understand what he's saying, and I don't like comparing, my illness to others either. However, I just feel as though it's not, it's not taken as serious as other illnesses are. I feel like if they don't know you, oh, this
Can
he's
you hear?
offline on this. He'll come back on. Uh, oh, here he is. Okay,
Yeah.
yeah, you're back now.
I can't
Let
see
me
you
see.
though. Oh, there you
There you
go.
go.
Yeah,
Yeah.
so I was saying I don't know why people it's like people of other races and other just walks of life. It's like they always try to tie themselves to, I don't know if it's everybody's problem, but I know they always try to tie themselves to like black issues. You know, you get all these different communities that try to tie themselves to slavery and you know what I mean? They try to tie themselves to, so when people get sick and they hear, when you speaking about like your full life, it's like they try to take that little section of their life and make it
Yeah.
match your complete life. It's crazy to me.
Yes, the my grandparents were Irish and they were slaves too. No, shut up. They were not slaves. That's not the same thing.
Not the same.
I'm
But
sorry.
but
I was choking.
I do agree with what you're saying because I have people. I had a dude tell me one time, "Oh, you have sickle cell anemia." Man, I'm anemic. I know what you're going through. Boy, if you don't shut up, I'll slap the life out of you. don't, you
Yeah.
don't you ever try to compare anemia
And
to sickle
it's
cell.
and this go both ways too, by the way. Like even like people with like traits, right? Um, I used to have this certain debates with a guy from California, uh, and we had like, you know, I just feel like you never know, you don't know what, how I don't know, you know what this particular crisis feel like. I don't, what this particular crisis feel like. All I know is they tell me that you got it the mild of the mild. So like but at the same time, right? At the same time, right? A person who don't live like us, right? To them, a 3 is a 10. You see, so who am I to again say that you know they're they're what they going through? Like I've heard women with sickle cell say that they'd rather have a go through contractions to go than to go through a crisis. But you hear other women say
I'm,
contract.
I'm, I'm gonna let you know just because you said something. I don't want to cut you off, but I didn't even feel my contractions. Do you understand? I felt the leg pain from sickle cell. I ain't feel them contractions, and the nurse came in and had to, how they hook you up to the machine to like measure your contractions, and the line were like it. I should have been like out, and I literally was like, I don't feel anything.
Yeah. And see, like you're not the first because I asked, I asked a bunch of questions, right? So you're not the only woman that done said like, oh no, I'll take contractions over a level 10 crisis any day. Like I've heard that. So, but if you ask a woman, who been cool all her life, contractions is the worst she ever had. You see, but to her that's level 10 though, right? So to her that's level 10, but you like, oh, it was alright. It was another scratch.
It was literally a walk in the park. Like I was like, and the way multiple nurses kept asking me, like, you don't feel this? I'm like, should I be? Like, is it supposed to? Like,
Yeah, don't
I'm
have
like,
me scared up in here.
I'm like, oh, that does look like a lot. I'm like,
See,
I'm
I,
like,
I learned like with my wife that sickle cell pain shouldn't be compared to anything else. You know, she used to have these real bad migraines, and in my head, I would be thinking, it can't be that bad. Like, I'm sitting here walking around, like, my arm is feel like it's about to fall off right now, and she's crying because her head hurts. But then I had to realize, there normal pain for normal people is bad pain. Whereas
Yeah.
me, I get a migraine, and I'm like, man, my head hurt. I'm gonna go chill out. It don't bother me as bad as anybody else. So I don't look at migraines as a bad thing when I should, because migraines are a very bad thing for people. They don't bother me. Get a little headache. I get a little dizzy sometimes. Yeah, cool, whatever. But the pain isn't that bad for me.
But see,
So I've learned that I have to separate what regular pain is. Because I broke my ankle when I was young and walked on it for a full week before I told my mama. Because I was scared that she was going to whoop me. I've hurt things that normal people would run to the hospital for, and it just don't bother me. And I've learned I have to separate these things because sickle cell has ruined my pain factor.
Yeah.
Ruined it.
my daughter had a broken arm at one point, bro, and she was playing all day, but she would cry at night. This is how. So when we took her the first time, they didn't see nothing. Then when we come back, you know what I'm saying? Again, that next day, she playing. She cool. But then what made me take her back again was I saw that her arm was deformed. You know what I'm saying? So, but she was playing like she was playing literally all day. It was just at nighttime she would complain. Um, and so yeah, it's but information, right? Information, the lack of they don't too many people that I'm gonna say for me, don't too many people I know, ain't too many people I know have read what sickle cell is. You see what I'm saying? To actually be able to have this type of conversation with me. Um,
Yeah.
so they wouldn't know that it says that this is the worst pain, even in medical books. You know? So yeah, but 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 people always try to fit in to something.
That that
Or
aggravates me.
You know, I think one of the worst times, and since we're talking about mental health and uh psychologically and comparing it to other, illnesses or deformities or anything of that sort, right? It reminds me of a time when I lived in El Paso, and I had a doctor whose hands were like, they were literally like, I'm double jointed, so I can make it look weird, but they were like, really like messed up, and so he comes in there and he triggers me because, mind you, I haven't went off like completely, like lost my stuff on a doctor since I was younger, like way younger, because I don't believe there you're not going to get a solution yelling and going back and forth. I'm not that type of person. When I'm in the hospital, I'd rather get results, rather get the solution. So, but he completely triggered me. When I say triggered, I didn't even know I could be triggered like that still. But he came in there and he was like, you don't know what pain is, you've never dealt with pain a day in your life, and telling me he's going to take my pain meds all the way down. That part I wasn't really caring about, because it's like when people try to use their power, I always just fire them, because it's like you're not God. I'm going to get the treatment that I need. So, but it was more so of him saying to me, "You don't know what pain is," and showing me his hands. Like I said, they were all like deformed and like crooked, and and he's like, "I know pain. This is pain." And, you know, I looked at him and I was instantly triggered, because how dare you tell me I don't know what pain is? I've never dealt with pain. And, to say, to, in the same breath, expect me to feel some sort of empathy or sympathy for you and your pain, but you can't even acknowledge that I am going through pain. You think that I'm here for what? You think this is a carnival? It's Disneyland? You think I'm here because I need a vacation from life? No. So I was totally triggered, and I told him, "F your pain." Because you're not worried about my pain and I'm not worried about yours. Because he's like, oh, how could you be so insensitive? For you to even fix your mouth to tell me how could I be so insensitive when you came in here and triggered me, literally, you're insane. You're crazy, and I don't need you nowhere near me. And it got so bad. We were screaming at each other so loud, all of the nurses on the floor, because they all knew me. So they all came to the room because they never saw me act like that before, ever. So they were just like so shocked because they're like, what is going on? And once he left and I was able to calm down, like I told them, like, it was the type of, the way he was talking to me and being condescending and acting as if I'm here faking for medication. Like I've heard doctors say that to me, but not one has ever fixed their mouth to say that I've never felt pain a day in my life and all that stuff. Like that was like, oh,
I've had
let me tell you something. I
I've
was
had doctors
instantly triggered.
tell me that I couldn't really be in pain because if I was in as much pain as I say I would be on the floor screaming and crying. I was like 30 at the time, and I'm like, do you realize what it's like to have a disease for 30 years that you deal with? If I come in here screaming and crawling on the ground, I'm faking because you learn how to handle things. That's how life works.
Right, right.
If
You
you
live with
go
this
through
your whole
something,
life. So you
That
think by the
part.
time we were in our 30s that we're still going to act how we acted at 10,
yeah, that doesn't make sense.
even
When I
50?
was a child, yeah, I would come in here screaming and hollering, but that was 20 years ago.
So I got a question. Well, not even. So what you was well, no, this question. So do what he was doing to you by being cool with um seeing you in pain, do you think that like make a block for you to make it to the point where it's like I don't care what you really go through at this point, I couldn't see you, you know what I'm saying, as nothing. And I'm asking this,
Um,
I'm gonna tell you why afterward.
okay, so you're asking me, did
But
that
you have no
basically
remorse almost. Do it make you be able
about him?
to
Absolutely. I 100% will say yes because I'm a very empathetic person. Anybody who knows me knows, like, I have the ability to put myself in other people's shoes so much so that I could understand the majority of people when they tell me whatever they're going through, you know? And I do. I'm very empathetic. I'm sympathetic. You know, I have that quality, and I say it's a quality. Sometimes it bites me in the ass, but it's really a quality that I appreciate. But I also have the quality of not giving a damn
right.
when I'm pushed to that point. And I feel that he pushed me to that point because there was no, like, when I say he had not 1 ounce of, like, he really in his heart of heart believes that I never dealt with a pain. Christ, that I don't know what pain was, even though science, everything is saying, mind you, my hemoglobin was like, I think at that time it was 4 point something, 5 point something. It was very, very, very low. So, most doctors, they like to tell about the labs or whatever. So I'm just saying that it was very clear that I was going through, in a doctor's perspective, a pain crisis. So for him to come in and completely just not care at all, and not, and really feel that I wasn't even in pain, because again, like Nathaniel said, I've been dealing with pain my entire life. So I'm not, right now I'm in pain. Most people cannot even tell. some people who know me well, they can tell by the tone of my voice. They can tell by when my voice gets like a little hoarse, and I rock back and forth. I start rocking, and I can't help it when I'm in pain. So though there are little telltale signs, and if you really pay attention to me, you'll be able to see, oh yeah, she's in pain. However, you're not going to see me cry. If I'm crying, we are so astronomically like past the point of no return for my pain. That's how bad I have to be in like a crisis of just the worst. If you see tears, if you see tears, it's crazy. So I don't cry because I've trained myself not to cry. I've trained myself not to react emotionally to this pain because all it does is make it worse, and we
I
know that.
agree. I agree.
And
I'm the same way. I can be in a high amount of pain and not be crying. But like if I really am crying, then I automatically know I'm being kept.
yeah, yeah, because there's no way. And so I'm not going to, one thing I'm not going to do, I'm not going to placate to no doctor. I'm not going to pretend. I'm not going to sit here and cry because you want to see it look like I'm in pain to your perspective. I'm not going to do all of that. But if you have a conversation with me, if you take the time to actually speak to me, I can express how I'm dealing with this pain the way that I am, and why I'm able to have a functional conversation or just sit there and distract myself from this type of pain. But like I said, with that specific doctor, it was I he was fired. He was fired when he came through the door, okay? Because it was there was no, like, sometimes I can have a disagreement with the doctor, and they can, misstep on my treatment, and then we have a conversation, and I can still keep them as my doctor and proceed forward. However, there are other times where I know if you on a power trip, you're not going to play God with me, because I value my life, and I'm not going to sit here and allow you to think that you have, some sort of say of whether I live or die. Because whether they want to admit it or not, that is how bad and how critical sickle cell can be. I can go from being in this pain, and if you're not treating it properly, I can have I can have a stroke. I can have a heart attack. It is shocking to your system. So you can't like possibly think that I'm going to put myself in a hospital setting where I'm supposed to be receiving help, and sit there and you're torturing me. I will leave. I don't care. I don't care where I'm at. If I got to go an hour away from where I live, 2 hours away from where I live, I'm going to do that to get proper care, proper treatment, because I'm not going to let and allow someone play God with me, and I'm not going to raise my blood pressure even more than it's already raised because of the pain, just to argue with you, or put myself in a position to have to explain my illness when you already know. You if you don't know, you can go and look it up and figure it out. It's scientific. Nothing that we say is like so far outside of the realm of what the truth of having sickle cell is. You see what I'm saying? Like when we try to explain ourselves in a way so that doctors could understand, our medical professionals could understand, and they say, oh, well, I never dealt with this. At this point, you're choosing not to know, because you have the patient in front of you explaining, and most of us are very intelligent and can explain it in a way that they should be able to comprehend and understand. As well as you have books, you could go online, you can look it up. There are so many ways. You can call sickle cell experts. There's so many ways to get the information. At this point, if you don't know, you don't want to know. And if that's the case, I don't want you nowhere near me.
I think what one of the things that bothers me is when you don't have like your hemoglobin is normal, but you're in pain because pain can be caused by anything. Like the lady said earlier, I could
Yeah.
go outside and run up in the hospital. My hemoglobin can be perfectly fine. I'm in pain,
Yeah.
but because you don't see it in my blood, you think I'm faking. That aggravates
Yeah.
me. It's aggravating because
Me too.
there's so many ways of learning the things that cause sickle cell pain. Like a book, you
Yeah.
read a book, it's right there. But people refuse to
Mm.
hear these things because they think that everybody takes sickle cell from the scientific definition. But the problem is sickle cell affects everybody differently. What makes your body go in
Yes.
pain may not make my body go in pain. What causes you stress not gonna cause me stress. What you know what I'm saying? Life is different for everybody, so sickle cell is different for everybody. So you can't just look at
Yes.
sickle cell as this is a blood, which literally is cancer, but they don't consider it cancer because black people. But this is a blood cancer, and it only affects you if your hemoglobin is this. Da, 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 da. You can't look at sickle cell like that because it affects people in so many different ways. Like being depressed can cause you to have a
Yeah.
sickle cell crisis. It's so many levels to
Yeah.
this, but people don't take the time to
Yeah.
learn these things because they don't care. That's all I'm saying.
No, you're absolutely right. That I feel like we already answered. We really answered this next question, which is, can you share a time when your mental health needs were overlooked because the focus was only on your physical symptoms? And I feel like that is all the
Yeah,
time, and
yeah,
we really
that
answered
was definitely touched
that.
on. I feel
But
like
if
that
anybody wants,
all the time as well. When you go to a hospital, they're there to look over your physical symptoms. They're not mental health therapists or a therapist in any sort. So they're there to physically look at you. But I feel like it also somehow they should learn the mental state of it as far as at least sickle cell patients, because I swear it's like everything affects us. Just like a few of you
yeah,
guys were saying, depression, anxiety, that can cause us to go into a pain crisis. I've even had people like
yeah,
friends, people I've dated in the past, like, you show no emotion sometimes. I'm like, it's not that I don't show emotion. I don't allow myself to stress because it can cause me a pain crisis. And that's what a lot of people
yeah,
don't understand. Like, I'm not,
Amen. I'm
if
sorry, not
something
trying to cut you off.
happens,
I just had to amen you on that. Thank you.
oh yes, 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 yes. So anytime someone like does something that they feel like I should react to a little bit more, I'm like, um, I'm going to react in this kind of way, because if I react how you want me to act or how I should kind of technically act, that would cause me to go into a pain crisis. And I don't want that. Like, I'm protecting my mental health as well as my physical health. And a lot of
so
people don't understand that part.
has has any of you ever been in the hospital and they tried to basically act as if your pain was all in your head, and so they would like call the mental health people to evaluate you and see if it's just something that's like mental or it's actually physically
It's never gotten
bothering
that
you?
far.
Yeah, I wish a person would bring some mental people up in there. They gonna get the worst version. I don't mean
That
like physically or nothing. Like I like man, you don't get y'all stupid out of here, man. Like
I never it's never went that far, but I've had doctors pretty much tell me, well, everything looks fine, so we're just gonna cut your pain medicine off and until we can get you out of here because all the tests that we did say that you're fine. It's like your options are go home or stay here and be treated like shit. That's what they do to you. I've never had to
Yeah,
Mhm.
call a mental health person because if they did, I would slap the shit. I'm fighting. It's gonna be a fight. You
No,
start to
I've
act
had,
like I'm
they've
crazy
called
because I'm telling you I'm in pain. I'm gonna flip out. I'm gonna flip
they
out.
have called the people for me before, and it didn't go at all how they thought it was gonna go. Um, yeah, I can definitely say that. But here's the thing, and even this very last, I just got to the hospital almost 2 weeks ago now, and this was like not the best visit. It wasn't the worst, but it definitely wasn't the best. And some parts were very not good. And it was crazy because as we stated before, the labs are not gonna always show. When I got the day I went in there, my labs looked one way, right? The very next day, my hemoglobin dropped to 6.8.
That's
And
what
so
happens to me every time.
yeah, they're like, "Oh, okay, so you feel the pain before, your labs kind of go haywire." I'm like, "Yes." And here's the thing. You guys keep trying to go, and they kept trying to go by my labs, and I told them, "I understand you guys have to read my labs, and I understand right now it may be showing, oh yeah, there's something going on here." You know what I'm saying? But that's not always the case.
Yeah,
I don't always have, a low hemoglobin when I'm in a really bad pain crisis. I don't
yeah,
always have, a high retic count, a high white blood cell count, or infection or whatever. Again, we all are talking about, sickle cell has many triggers. It could be because now, guess what? I am on dialysis, and when you're on dialysis, you can only have so much fluid. So kidney failure and sickle cell contradict each other, because what are we told as kids? What's the number one thing? Hydrate, right?
mhm,
So for me, I have to be very careful. There's a very fine line I have to walk, where I can't drink too much, but I also cannot not drink enough,
mhm,
because we all know sickle cell, give it a reason to act out, it will. And being dehydrated is reason number one. We all know that. So it's a very difficult time for me even right now. And it's like, that is a trigger that could be affecting why, I have these pain crises sometimes that I do have, and where my labs might look perfectly fine. And then it's like, well, what's wrong? It's like, well, I'm dehydrated. I can't, drink too much water. So it's only so far, I can go without having these pain crises after a while, of going through, pulling all that fluid from my body, and then on top of that, not replenishing it uh, the way that I need to, because of the sickle cell. So again, like we stated, those are other triggers that you can't see that on labs. You can't see, oh, she's dehydrated on labs. But again, if you know me, my daughter, she knows when I'm dehydrated. My daughter will look at me, my eyes are rarely yellow. And if my eyes are yellow, I'm not drinking enough. And so she will look at me, and it could be the slightest yellow tint, because she knows my eyes are never, rarely are they ever yellow. So if my eyes are yellow, that means I need to drink more water. So she will look at me and be like, "Oh, mom, you need to drink some water because your eyes are yellow." And I could look like, dang, I can barely see the yellow, but she sees it because she sees me all the time. So the fact that there's even just a slight yellow tint, she's like, your eyes are never yellow. The only time they're yellow is when you're dehydrated. So again, she knows that. Whereas I just went to the doctor today. I have a new hematologist, and he looked at me. He's like, "Oh, you just have slight yellowing in your eyes." To him, that's like, "Oh, it's just slightly yellow, and okay, it might be." But to people who know me, they will know. Okay, you're dehydrated. You need to drink some more water. You see what I'm saying? So it's all a part of a bigger, more complex part of our illness. And the fact that we've lived with this our entire lives, we know things that doctors are never, they're not trained to pick up on unless they specifically go out and learn more about sickle cell and learn their actual patients. Then they will know better. Versus, if they're just like, you know, it's I've dealt with sickle cell patients before. I know it's like, you can't. I'm different. We are not the same. So that's the whole issue in itself. And I just really hope that some part of them changes somehow, have more training, something, because it's ridiculous, honestly. It really is at this point. Anybody want to add anything before we move on? Okay. Now we're going to go into. Okay, we kind of talked about that already. Um, do you feel that mental health care is adequately integrated into sickle cell treatment? If not, what's missing?
Hell no. Hell no. I mean, not for me. Like, so I don't know if I can't speak for everywhere because I don't live everywhere, but out here in Louisiana, healthcare is a joke. So mental health care is even more of a joke. And we, our doctors, like I have a great doctor. He tries to get me to do all kinds of stuff. But on the other side of that, there's no mental health that's just like readily available for people like us. We don't fit the plan, I should say, I guess. I don't know. But you see other like cancer centers everywhere and different things. And it's like these people get treated greatly. And when you come to sickle cell, you're a drug user. That's what you are. You walk in and they don't care about your mental health because they don't care about your physical health. It's hard to care about mental when they don't care about your physical. Like, I don't care if you die, so why would I care if you're thinking straight? You know?
Yeah,
That's my experience. Like I said, I can't speak for everybody.
yeah. Anybody want to add?
To yeah, to add on to what Nathaniel was saying, I think that we, as sickle cell warriors, we shouldn't just have doctors treat us. We should have doctors that are trained specifically to treat sickle cell patients who have studied the process more, and then also,
Amen. Once again, I'm sorry.
yes, who have also studied mental health in an aspect to where they can tie it into sickle cell more, because we have doctors here that are taking care of us who don't know our history, that have learned from a page in a book. My sister is going to nursing school right now. She literally told me this information on sickle cell. It's not even a full page. I think she said it was like half of a page. But for that to be the information that they're learning, and then to go out into the world and trying to treat us, that, no, it doesn't work for me. Like, that just doesn't work.
Yeah,
So
absolutely not.
that's what I've been speaking about a lot. Uh, about I we went when we went down to Illinois, the capital of Illinois. Like I was down there even talking to the politicians, and they said, "What do you think that it need? Like it need information. There's no way that you'll be able to learn and properly treat a group with only a half a page. You don't reduce them to a half page. That's actually I was telling shit the other day where I'm trying to come up with a concept of one of my paintings to be about. Uh, uh, trying to see, like, that's the only one of my artist buddies was saying, like, try to paint the solution, and I'm trying to get him to understand, like, nah, I don't. You don't paint the solution. This, you paint. You got to paint the pain. You got to paint the problem.
Yeah, paint the problem. Yeah.
Understand what we know. You saying paint. You telling me to paint for outsiders. And I'm okay with that, right? But I feel like one of the only ways to I do like one of the ways to paint the solution is to show what can happen, and if and but it has to be with a if only type of thing. Like, if only there was 300 pages about sickle cell, maybe you all actually know what it is to us. Besides, and then if you talk really to the nurses, and they start, like, you should have them ask you some of those questions that they be having in the book, in that half a page. Some of it is almost leading to the fact of that person can't be in pain because he on his phone, type of thing. Um. So yeah, yeah.
Amen.
The whole thought of trying to they got more people like George Washington and all these people. Um, and these are all false things,
Yeah.
but they don't have really too much nothing about us. And like I say, you'll never get a whole bunch with a little. But
Yeah.
all right, I think within the hospital, the reason why they're not able to care is because I think another thing that's needed is, I think every doctor and to have to do some type of compassion, because more that the more that so think about the nurse.
Can
uh,
everybody mute their just 1 second, Master? Can everybody mute their mics while Master's talking, please?
think about the nurse that comes on her first day, right? And she see her first sickle cell crisis, right? And her first baby or something like that in pain. She's hurt. She's like, wow, like, especially if she's a mother. She's hurt. She's messed up by it. She like, man, or an elder, she hurt by it. But we all know that the more of something, the less it affects you. The better you get at it, the better you get at even being to cope with it, right? Um, if a person tell you I lost every member of my family, by the time he done got to the last one, he probably ain't even crying no more. And so, I just think that they need to have something for that nurse that been there for 10 years and that done saw everybody in the crisis, all of the people, and like, and she don't really have now the only thing that she knows, she's gonna be the nurse that's gonna tell the new nurse that's only been there for a month, oh, old girl in room 340, yeah, she's just looking for pain medicine. See, she gonna be the one who corrupt the new upcoming. So now when the upcoming nurse goes in there, she listening to the one who been there for a while. And when she go in the room, the moment that you raise your voice, it flicks to what that other nurse just said. That's the first thing that she thinks about. You know what I mean? If this seasoned nurse who has no more compassion because she done dealt with a couple of frequent flyers or whatever you call it. She done dealt with a couple of them, right? She done dealt with a couple of people cursing her out, and a lot of times we only hold on to the worst that we seen of something, and not the best that we seen of something. She not looking at the 90% of sickle cell patients that done came and was peaceful. They only holding on to those that 10% that wasn't. And so when she tell that newer nurse, like I said, old girl in room 350, Yeah, she irate. She just looking for some pain medicine. The moment that you yell, the first thing that new person is gonna think is exactly what her boss or her elder said. You know what I mean? And then that just keeps a cycle going until you might get one or two people that's gonna come and like straighten it out in a sense. You know, you might get one or two people that's gonna tell one of them like no, you can't look at people like that. It's individual based. You don't know why she spazzed out on that other nurse. You know what I mean? But like the the doctors and the nurses both, I think that they need I think that the hospital, should I say, needs some type of compassion test because I find it very weird, and I'm sure all of y'all gonna agree with this. I find it very strange that the nicest person in the building is the lady that come in there and change the garbage. Like this is the nicest person that you meet in the
and the food people.
and the food people. Yep.
Yep,
And they
very true.
But I want to like piggybacking off what you just said, man. You would not imagine how many nurses I've had to give the old sickle cell speech to because they don't understand it, and I don't blame them because I know what they teach in nursing school about sickle
mm-hmm.
cell. Like she said, I'm sorry, I forgot your name. I apologize, but she said that her sister told her that there's half a page on sickle cell, and that is facts. It's my wife was going to nurse school for a while. The book she had, it was like barely a paragraph. The bottom of the page was sickle cell, and I read it, and I'm turning the page. I'm like, oh, let's see what's next. And it just was like on to the next thing. Like I think leukemia was right after that, and I'm like, wait, this is a paragraph. There's no information here. It's really the basics of sickle cell. Your blood, blah blah, hemoglobin, blah blah, retic count, blah blah. Moving on. And that was the conversation, and so I don't blame nurses. I've had to talk to so many nurses just to get them to see like
I do.
what you
I was gonna say the same thing. I kind of do too. I kind of still blame the nurses because you're going to school for this. Like my sister, now that she's a nursing student and seeing the me growing up throughout the years and what I've dealt with in class, she's told me multiple times how she's had to speak up about things regarding sickle cell and what it is and how people deal with it. And teachers should know better, nurses should know better, and I feel like they should be speaking up in class like, is this all I'm learning about sickle cell?
when I say I don't blame them, I'm not saying I don't blame them on not learning on their own, or especially once you become a nurse and you work with people that have sickle cell, you should want to know what that is instead of basing your opinion off of such
Yeah,
stupid.
the
But
information is out there, so that's
when I
my
say
thing.
when I mean
Yeah.
I don't blame them is I blame the system. The system is set up for people not to care about sickle cell. You know, that's what I blame. Now, does that mean that they get off the hook for that? No. I'm just saying when it comes to the system has to change. This is a fundamental change we have to make from we can't change this with doctors, we can't change this with nurses. Hell, we can't change this with hospitals. This shit gotta go all the way to college and
Got
change that shit from the
to
beginning, from the door. You know what I'm saying? Like when you walk in the door, it has to be this is what sickle cell is. Not, oh, sickle cell, moving on. This is what sickle cell is. We need to do a course study on sickle cell like we do a course study on every other disease, you know?
To touch on that, what I think needs to be done is sickle cell warriors should be speaking at campuses as well as hospitals to inform nurses and other people about sickle cell. my doctors had me talk to new parents who found out that they were about to have a child that was going to have sickle cell. Um, and that was my first time doing it, but and I think I did it maybe like two other times after that, so a total of three times. But things like that, I think those are things that we need, our own voices.
So let me say two things, right? One, Marlene, is that I don't think the question should be, is this all we gonna learn about sickle cell? I think the question should be, why is this all I'm gonna learn about sickle cell?
Mm, yes.
But also on the other thing, we the problem. Uh, so everybody saw that dude, that Charlie Kirk dude. He was talking about all black issues, but he overlooked the, all of the pedophile, like the pedos in his community. He overlooked all of the strange stuff that goes on in his community, right? Um, but he talked about everything that was wrong with the black community, as a white man. And I think that we be having to stop expecting the doctors to save us. They're not. They already showed us that they don't want to. We also the problem because I can guarantee you that your sickle cell association have more fun than anything, uh, uh, throughout the year. Yeah, throughout the year. Uh,
Facts.
I can guarantee that your sickle cell association. So it's like, why? Why so much fun? Like, why? Like, to me, it's some blinding type stuff, right? Um,
Where's the money going?
well, if they got to pay themselves, so they probably making 100,000, 75,000, like that type of stuff, right? But at the end of the day, right, you're able to see the books for that if you wanted to. But also, we what I mean by we gotta save ourselves, like, is that just like the alphabet people, they did their thing with these politicians, and look at all the laws they get. Um, uh, Hispanics at one point before old boy got in, they was getting everything too. Um, but them alphabet people, they untouchable at this point. Shit, they man, they got it. They got more rights than black folks at this point. And they get to tie themselves to almost to slavery. They get to make it seem like they're just as targeted and all of that, right? So, but they paid into these politicians too. And I'll be trying to say, like, the sickle cell community have to do something for themselves, because if we waiting on the sickle cell associations, we just gonna get skate parties and bowling and walkathons. Yeah, that's what we gonna get. I mean, being realistic, like, I'm not saying that that's not needed, but I'm saying that that's not needed more than this stuff. You know what I'm saying? And nobody is gonna speak out about it.
What
No,
we need, what
yeah,
we need is to come up with a plan to get legislation on the board that teaches people how to properly take care of sickle cell from the time they go to medical school. This is like these are the things that would change things instead of talking about getting doctors' attitudes right. Because sometimes you just gotta say F them people. They gonna be who they are.
yeah.
It's a
F them people.
system built. It wasn't built for us
Change this.
Yeah, and
to
Exactly.
that's the
begin with.
thing too, Nathaniel, that you mentioned. I don't know how it varies in every state, but in California, I know being an advocate for sickle cell and being able to connect with some of my doctors, we've tried for funding from the legislation and stuff like that. We've written letters to Congress and stuff like that to get funding for sickle cell, and we asked for a certain amount, and then we were denied three times, and then one time they gave us like I forgot the amount, but I'll say like $2,000. It was like, what are we gonna do with this?
We have to get
So
the 5 white people in the community with sickle cell to start speaking for us. I'm not trying to. I'm making a joke, but I'm not being funny. There's white people
I
with
think
sickle
that
cell.
like
If we get them to start coming to the forefront and being like, "Hey, do something about this disease," white people listen to white people.
I think first off it got to be a trust thing. Somewhere
No, it's money talks,
that's
honestly, because it don't matter what color you are. If
that's
you
what I'm
got
about.
money,
Somewhere it has to be a trust thing between us as patients, and two or three people, or maybe two or three people within each state. This is the only way I see it being set up and working, where is some people where this person watch this person watch this person. But at some point, right, we gonna have to start taking. I don't care if you get SSI. I don't care if you actually work. At some point, it's enough. If it's 500, if it's a, let them tell it it's 100,000 bucks, but it's way more. We know that. Imagine if that. Let's just go with the 100,000. Imagine if that 100,000 sent $5, right, to pour into lobbying. Now, imagine if that 100,000 that they say we have sent $10. You know what I mean? Like it's enough of us. It's just that we're not coming together collectively. And then let me tell you what else gonna happen is that you can have somebody that's gonna come in with a brilliant plan, right? And it's gonna be somebody that wanna be smarter than that person. So that's gonna be a problem. Like we gotta first even stop fighting amongst each other. But everybody want to attack the doctors. But what about you?
Hey, I tell you what you saying right now would be a perfect time. I hate to say this, but our president, the country's for sale. That man would do anything for a check and for you to say something nice about him. With him in office, we can get anything paid with the right amount of money. Just saying.
He there now though, so I don't know. That's probably should have been done when he was going. Yeah, but I was told he was the one.
I don't even want to talk about that
I
man.
yeah, no, I definitely understand what you guys are saying.
I'm just
I
saying
do think
the country
that
for sale
there
with him.
should be more. I think that there should be more legislative advocacy. I am, a part of that world, and when I go show up for, the advocacy meetings where, I'm speaking with politicians. I've done it in Texas. I've done it in Cali. Now I'm doing it in Las Vegas. And here's the thing. When I show up to those meetings, I'm the only sickle cell patient there. You understand? In 3 different states. Every time, I think in Texas, it might have been the only time that it was more than just me showing up. It was a
That's
couple
why we
more, a
have
few
to
more, but
get we have to get
here's the things: when we incorporate ourselves into those rooms and those meetings, speaking with politicians in numbers and saying the same things, that is what pushes the needle forward too. And again, it's all about, like you said, master, self accountability. It's We can talk all day long about all the stuff that's happening. What are we going to do about it? What's the solution?
so that's the thing
Where
with
do we draw the line and actually stand there and hold not just the medical community accountable, but ourselves as well? Because I can, I can say all day long, oh, yeah, I hold myself accountable and I'm, doing all that I can as a sickle cell patient to stay healthy, to stay, keep my mind right, keep my health in order. But if I am not contributing to the solution, then I'm a part of the problem.
Well,
So,
you remember when Ice Cube he wrote up a plan for Trump when and everybody had something to say about it. But
mhm,
what the alphabet people got is they actually together and they don't care about
mhm,
they don't put even their race before being that whatever they are.
mhm.
You know what I'm saying they don't put nothing before that. We willing to put everything before that. You know what I mean? We willing to put how we feel about each other, our differences. I don't want to work with that person because that person got this amount last week, and we willing to
That's
put all of that. And uh, as long as you keep a purpose, a people, a group of people separated, you can do whatever you want to them.
but that's why I said we have to come up with a group like okay. So let's say there's the twins from they used to play with the Patriots. I can't remember their last name right now. Then there's what's his name that played in Love Jones. His brother has sickle cell. He speaks out about sickle cell a lot.
Barber,
People like that. People like that. We get them in the room with the right people, not just anybody. That's people with a little bit of power and a little bit of money that can make legislation change. You get what I'm saying? Like
No, see, so you keep saying that we need to depend on other people. That's not. That's
they got
we're
sick.
never going
no,
to
they
get
have
it if
sickle
we
cell. I'm
keep
talking about
asking
people with
other
sickle cell.
people.
They got them people with sickle cell. The Barber twins. They people with sickle cell.
I understand, but here's
They
the
ain't
thing:
all this time, huh?
if we keep giving right, if we keep saying, "Oh, we need somebody famous," or "We need somebody with money to just come in," it's not going to happen. We have to be responsible for ourselves, and as much as we go through, and much as we have going on, if we cannot take the time and come together. I hear you, Master. You're right. We all need to put everything aside, feelings, emotions, who came up with the idea. None of that matters. You know what matters? Progress.
Yeah,
Progress matters. And we're not going to get any true progress until we really come together. Again, you're right. It would help if they would be a vocal point and put their money where their mouth is, and in some ways they do, but however, the ways that we need them to, the ways that we are speaking about, they have not done it yet. So literally, from the point I'm speaking of, is just we have to hold not just the medical community responsible, but we have to hold ourselves responsible.
yeah,
We have to give each other a leg up, meaning we have to come in and say, you know what? We have one common goal. What is the common goal? There's a textbook at this point that is just full of sickle cell education. Why is that not introduced to medical schools?
yeah. I think it needs to be
Why
because
why don't we come together and actually make that a part of the curriculum for these medical students?
That's
Anybody who wants to be a nurse or a doctor or whatever the case you want to do, there's a whole book. And again, it will start with policy change. However, if it's only one or two, three, four people, they're not getting the full enchilada. They only getting a little bit of the situation. They're not getting the full weight of how terrible the treatment is. And unfortunately, we got we I got a whole horror series that I'm doing, sickle cell horror stories of all the difficult and terrible treatment that I've had in my life. Now, how is it that I have all these stories, and I feel like it's me too, because when all these things are happening, when these doctors and nurses are treating us wrong and treating us badly, that's when we need to be recording it.
we need
That's when we
we
need
need
to
the
be
million sickle march.
what
something like
what I
that.
was
Yeah.
what I was but that's what I was trying to say is we get people together. The only reason I mentioned the Barber brothers because they have sickle cell and also faces speak louder than just the regular person. You could get people listen for some reason to people that they can recognize. It's dumb, I know, but it is what it is. Celebrity gets you places for some reason. But I think that what, and I'm not saying like we as a community shouldn't be behind us. We have to come up with a way to get us behind sickle cell, and then we can make bigger plans to move bigger things if we had the support of people that can get us in rooms that we can't walk into by ourselves.
And we gotta start holding the see, he's talking about that, right? Legislation and all that stuff. See, I thought that the associations is all these groups that's getting money for us is supposed to be the spokesmen for us. It's supposed to be the people who speak for us. If you got all these consortium and all these other groups, you know what I'm saying? Like what's going on besides, you know, medicine and parties.
And
And
the only foundation that actually seem to be doing something is the Breast
what
Cancer Foundation. That like they for some reason, and they still for all the money they get don't do enough.
what they can't so when you get money from the government, you really your hands is kind of tied. You think they're gonna give you money and then let you go pay into uh presidential campaigns with it as well. Um nah, it's clause and stuff on those non for profits.
Yeah.
I
So
tried to start a nonprofit. Tried. It worked out for like a month.
Yeah, it's
Then,
clause.
then people stopped caring immediately.
It tell you that you can't do things with that money. You don't see
it
the
depends on where your funding comes from. You're absolutely right.
you don't see the church politics,
However,
do you?
huh?
You don't see nobody in the church in politics. You don't see these big mega churches with the pastors with the $20 million church. You don't see them in politics.
Yes, they do.
Shit, the
Oh,
evangelicals do.
if they
At the church I used to go
do,
to,
they ain't got no non for profit.
yes, most of these churches are being paid by the government.
Yeah, this is why what I'm saying is you don't see them trying to pay into the president. Like that's what I'm talking about. Like you don't see them changing things for the better for black people.
Well, no, because it's
Yeah,
only when
yeah,
you're getting paid by the government. You're absolutely right. There's only so much you can say and do
yeah,
because there are strings attached to that money.
exactly.
But
And when a nigga die, you the person that's supposed to come out and stop the riots. You the person that come out and say, everybody chill out. Jesus, we want this.
yes, I understand what you're saying, but also like just bringing it back to the mental health standpoint. I uh I feel that things definitely could be better as far as I've never really been like I feel like especially as a kid, no one tells you this is a very hard illness and you really should have a therapist to take you throughout your entire life. No one, and I went to quote unquote one of the best hospitals in the world, Cedar Sinai, for most of my childhood. And then I went to Children's Hospital. So I'm going to these prestigious hospitals, right? And no one could think to say, hey, you really should have her in some sort of therapy because this is a very difficult illness to deal with her entire life. They're quick to tell you a death date that they want to put on you, but there is no full, acknowledgement of the mental aspects of dealing with sickle cell. The fact that I not only have sickle cell, but my mother had sickle cell and she passed away when I was 7 and she was 25. that right there alone should have been a reason for someone in the medical, you know, community, as a kid growing up, to say, you know what, this has got to be hard for you all, especially you, grandma, because you just raised your daughter and you dealt with that her entire life, and she just passed away, and now you have to do it all over again with your granddaughter. Maybe, just maybe, you're a little bit traumatized. Maybe right now you're triggered because this is deja vu. No one ever, had those conversations. And I feel that they are necessary, and I can appreciate that there are more valiant efforts by certain nonprofits. I will give certain nonprofits, they do provide therapy, free therapy. I know Kind Wellness, they provide free therapy for people in the state of California. However awesome that is, I'm so grateful. There are so many people all over the country that are suffering, that don't have access to mental health, tools or therapy. So it's like, what happens to those people? I literally just, like I said, I went to a new hematology clinic today, and in this office, it's totally different from the one I just came from, where there's no information, no pamphlets on sickle cell, on the organizations that are there to help you cope and manage with this illness however they can, and the tools that they can provide. Um, but I was like reading all the pamphlets that they had on their walls, and I didn't know what organization this was, but everything that was listed that they help with, mental health therapy, pain management. It was like so many great features, and it's only for cancer patients, that specific organization, right? So it's like, you know, oh, feel free to join, but I'm just saying, at the end of the day, like, it's necessary everywhere, you know. So,
When I
what did you want to add?
when I was young, like I went to Tulane Hospital out here in New Orleans, and
Mm-hmm.
we had a sickle cell center in the actual hospital for kids, and we had counseling, we had school tutors when we were in the hospital, we had group therapy sessions where we sit around, like, and they taught us, like, when we were young, make sure before you have kids to get your partner tested, see if they have sickle cell, because you don't want to burden yourself with burden a child with the disease that you have, and so on and so forth. There was all kinds of different lessons they taught us growing up, and then it all just disappeared. The funding went away, and now that same place. I mean, I had an African doctor. He was from Africa. His name was Dr. Frampong. He was so great, such an awesome doctor. Like, really understood sickle cell, really treated you like a human. And growing up, that was awesome. And then for some reason, all the funding dried up, and it became a little room in the back of the cancer center. And I I don't understand, like, how you could allow that to happen. I mean, I get it, but I don't get it. You know what I mean? And that's the thing that drives me crazy is sickle cell doesn't get looked at the way
Mm.
that these, because that should never go away. If anything, they should extend it from 18 to an adult center also. But
Mm-hmm.
yeah, I just that's
Let me tell you something. Two. One is that I think that every sickle cell association. I'm gonna talk to my doctor. Matter of fact, but these hospitals and even the sickle cell association, like, if you have, they should be telling the parents, if you have a child that's with sickle cell and you don't have sickle cell, I think that every kid that has sickle cell with a parent without should have a transitioning coach from maybe 16 to 19, um, maybe 17 to 19, 17 to 20, somewhere up in there, right? Because it's a difference, and we know that, right? But also, I also think that people have to stop. Uh, People should ask the people with sickle cell who parent kids with sickle cell what it's like to parent kids with sickle cell while having sickle cell, right? Because now, of course, nobody wants their kid to have sickle cell. Of course, nobody, but I do agree with what they was doing with y'all was dope because I ain't never had nobody to tell me that. But I ain't know the chick had the, trait anyway. But nevertheless, uh, I would assume that it's easier for me to parent my daughter with sickle cell than it is for my mother to parent me with sickle cell. Because I understand it. My mother didn't. I'm a blueprint for my daughter. My mother wasn't. So it's a difference. You know what I'm saying? When I could look and say, oh no, it's time to go. And my mother didn't know that. My grandfather didn't know that. I mean, I'm just saying my mother, but my grandfather raised me. But I'm saying my mother, like, because even when she did, have me, like, it wasn't. I was told I cried a lot. You know what I mean? She didn't know why. Um. So yeah, I think that people have to should see what is, because I don't know if everybody like me.
No, I definitely agree with you because like I said, my mother has sickle cell, and while she was living, I never went to the hospital, and it wasn't because she didn't feel like taking me. It was because she knew how to treat me at home so well that within a few days, couple days, longest a week, I'm good to go. I've never been to the point of like needing a hospital when she was alive. And that was a full blessing. I feel like it did add years to my life of less complications because of that. For 7 full years, I never seen the inside of the hospital. I don't have the same stories that most sickle cell patients have of being in the little crib. And I went to the hospital when I was 1 year old, and after that, I never was hospitalized until I hit puberty, and this was well after my mother passed away. So again, it is different. It is a blueprint. It is a better, you know, smoother transition, because honestly, after she passed away and before, it's totally different. She knew what to do. She knew how to handle it. She knew, she knew what type of medications I needed, when. She knew what to rub on me, uh medicated aloe vera. She knew how much fluids I need. Everything I needed, she provided, to the point where I didn't even need a hospital. So, I feel like you're absolutely right, because once he passed away, I didn't have I didn't have that anymore. My grandmother, she did the best she could, but once I hit puberty, that was a different ball game for my health. It was like crazy. My body just kind of really just went haywire from that point, and I needed a hospital a lot more than I ever had in my entire life. And so, even in dealing with the hospitalizations, I did not have her for that portion of my life. So, to me, all of it was new. I didn't know how to handle it. It was to the point where when I was a kid, I felt the trauma, and I felt my grandmother, like her being triggered when I was in the hospitals. So I would tell her, like, don't come and visit me every day. And for the first part, when I really tried to get through to her about it, she she took it wrong, but it wasn't. I wasn't trying to be mean. It was really me trying to look out for her because I noticed how much it would affect her as much as she tried to act like everything was okay and come in and sit with me. I felt it. I felt that sadness, that energy, and it didn't help me. So, I would tell her like you don't have to come here every day. I don't want you to come here every day. Every other day. You could come and check on me and stuff, bring me some food, whatever, bring me clothes, whatever. And you don't have to stay with me until visiting hours are over. I want you to stay until you feel like, okay, it's a bit much for me, and then go home. I don't need you to because it's not going to put us in a good headspace together if you're triggered and I have to worry about you mentally because she suffered with a lot of mental health issues after my mother died. So, she would have, nervous breakdowns and stuff. And so in those situations, it it was a big stressor for me because I'm not worried about myself in those moments. I'm worried about her. So that's why I had to like put separation and boundaries when I was hospitalized. So I didn't have the support early on that most, kids have with their parents coming and staying the entire time. I didn't have that. Could I have? Absolutely. But it would have did more damage than good for us mentally. And I knew that. So again, I had to be an adult before I was even an adult in my mind, just to say, okay, we need 6 degrees of separation in these situations because it's not going to do us any good. And it wasn't anyone who, like I said, no medical professional saw this. No one said to her, oh, you probably should separate. No one ever, acknowledged any of that. It had to be me. So sometimes it does have to be you to stand up and say those things and be that person for yourself or for, if you have family members who have this illness. Sometimes it sucks. Yes, you have to be that person, but you got to be that person ultimately. And it's at the end of the day, it's not going to be beneficial if, we just say, oh, well, that's just the way it is because that's sickle cell. That's life of sickle cell. It's not. It's a choice. Everybody's faced with choices, and it all depends on what and how you would like to live your life ultimately.
But
My mom, like, I was born like in 1979. My mom, she didn't know much about sickle cell. Nobody, they wouldn't test for sickle cell back then, and I got diagnosed at 3 months, and she didn't know what to do, how to take care of me, or how to help or anything. And growing up in the hospital, like I had two brothers. She was a single mom. She would try to be there as much as she could, and I used to. I wasn't the best patient all the time. Like I'd be in pain sometimes. Like one time, I got mad at her and told her it was all her fault. She knew she should have had me, and there's all kinds of craziness. But as a mom who was raising a child, like parents with kids with sickle cell, it's hard. Like talking to her now as an adult, it's hard to understand what your child's going through, especially when you have no information about what your child's going through. It's different. Different now. There's a lot more information that's readily available, but back then there was really no information besides what a doctor could tell you. It's hard to raise somebody when you don't know what they're going through or how to help what they're going through. It's
uh, well, so do y'all like? Well, Shay, you answered it already, but like, do y'all prefer uh people to be in the hospital with you or to be alone?
For me, I prefer people to be in the hospital with me. Like Shabrion mentioned, I was the one as a child, and maybe up until like 12 years old, I always wanted my mom at the hospital. And luckily, she was able to come, even though I had siblings. She was always up there with me. And then my teen years, it was more so I still wanted her up there, but then I also was like, it's okay, you could go home because I wanted to, I guess, be a little bit more independent, act like I didn't need her. But for me, I always want company. Like when I'm in the hospital, that helps with my mental state. Um, yeah,
See, I tried not to like. I love company. I would love to have company, but I try not to bother people with coming because I don't want to be a burden. And I feel like I also part of me feels the people that care about you know they should know how mentally draining it is to be in the hospital, especially when you're by yourself. Like when you're
yeah.
alone all the time in the hospital, you get some very dark thoughts going on. It's like isolationism plus you're sick. You're sick. Like it's a double whammy, you know. And when, but I like I said, I don't want to bother nobody, and also I don't want to feel like I'm begging people to come see me. It's weird, but I would rather people be there. I would rather, but I would never put that burden on people. I used to do that with my wife,
We
and
gotta stop using that word, Nathaniel. Burden.
I know. I'm sorry. My bad. It's just I do be feeling like a burden though. You know what I mean? And
It's
You're
that's
easy
not
to feel like
alone.
a
I do
burden.
too as well.
Yeah,
I mean, we probably all do. Because I
yeah,
always used to tell my mom, my even my sister sometimes, like I don't call you guys because I don't want to be a burden to you guys. I know you guys have things to do with your life, and they would tell
yeah.
me all the time, the people that care about you, you will never be a burden to them. So we gotta get that specific word out of our vocabulary.
Yeah, I do to my
Yeah,
children.
it's hard
Or,
to go through it so hard, and it's no one can truly feel how we feel but us. So
Yes.
it's easy to feel so isolated, even if you can have a house full of family. I've been in a situation where I was after my grandparents passed away. Well, my grandmother passed away. I went and moved with my aunt and uncle, and they had 3 kids. So I'm in a house full of people, and I feel alone and isolated because no one is going through what I'm going through.
I
No one
tell
is
people
feeling
that
what
all
I'm.
the time. I'm not trying. I agree. I tell people that all the time. I feel
Yeah,
alone in a room full of people.
yeah, it's easy to feel alone. Even now, like, yes, me and my daughter are extremely close. Anybody who knows me, you could look at my social media and see how close me and my daughter is, you know? But there are times that I try to keep it to myself. And even those times, like my daughter knows me so much, she's like you're not getting, like, I know, like, why are you acting like you're fine and you're not fine? Like, and it's harder because I never wanted that to be our life, you know? I feel like when I was coming up as a kid, I had to be a caregiver to my grandmother and my grandfather after he had 2 strokes. And um I know what it was to, have to do the cooking and the cleaning and, having to be on edge because I don't know whether, my grandmother is going to have a nervous breakdown and something's going to trigger her, you know, and make her, want to harm herself or, you know, run out of the house in the middle of the night. And so there was so many times that I had truly bad anxiety to the point where it was like I didn't sleep. And so now to this day, I'm 35 years old, and I had been going through that at, age 9, 10, 11, 12, 13, so those years that I had to stay up all night just because my grandmother didn't sleep because she was having her mental health issues, so it still affects me to this day. I have to be prescribed sleeping medication sometimes because I just can't sleep because my anxiety, it gets really bad, in the middle of the night, or, once it's night, because when your body is so accustomed to feeling that anxiety, it's kind of like muscle memory. You know what I'm saying? Like, you can be totally fine or think that you're totally fine, and then you turn around and you have so much anxiety, you look up, it's 5 o'clock in the morning and you haven't slept. You see what I'm saying? So it's it's things like that for me, just acknowledging it and speaking about it and being vocal about it. It it changes, how I deal with it. And it helps to where, you know, I am very empathetic towards my daughter, that she has to deal with some of the similar things. Like, that's why I never, I'd rather sometimes, like, I do buy food out to eat if I know I can't cook for certain days, because I'm not going to put, cooking on my child. Yes, she loves cooking and she doesn't mind to do it. But if I know that I can't cook, I'm not going to just be like, every day this week, oh, yeah, oh, you're going to cook. No, because why would I do that? She's a kid and I know what that felt like. Even if I know I didn't mind doing it when I was a kid, when you look back, it's like I look back, I'm like, dang, I'm tired of cooking because I've been cooking so long. It becomes, a nuisance in a certain way, and I never want her to have to think about, because that's adulting, right? I can't take a break from adulting because I'm an adult now. I had, unfortunately, to be an adult at a younger age in certain situations. So I feel that I've been doing it for so long. It's like, but I just don't want to put my daughter in that same boat. So a lot of the times when I try to isolate it or I try to do things, it's not because I don't want her to know what I'm going through, or I don't want her to experience, knowing me fully. It's really just me trying to be careful so that she don't have to be a complete adult as a kid, because that's not fair to her. Whether or not she do it because she loves me, just like I did it because I loved my grandparents. And if I was, if somebody said, "Oh, would you do it again?" I absolutely would. I don't regret it. I'm just tired. So that's the thing, it ultimately, it builds up, that want to kind of isolate yourself and try to do everything on your own and be hyper independent in my case. So yeah, totally understand it. And I think that we kind of got through a lot of the questions. If anybody who was watching, if you have any questions, now the time to ask, because we're going to be wrapping this up. um if anybody has anything they want to say that's on a panel, anything you want to add, I mean, I pretty much we pretty much discussed everything without even going over the questions for real. So, or the rest of the questions, because we did get a lot of them out of the way.
I would just like to say that more of this is needed. More of this in bigger groups. More,
Happening,
just,
brother. Got to get into.
huh,
Got to get you consistently.
sir. First of all, what we not
Nah,
gonna do,
nah.
what we not gonna do
Huh?
is slander. Okay. Hey man, look, I'm be honest with you, dog. I be I be in dark places. I get depressed and I shelter myself off from the world. Then I pop out and I go back in. I'm working on it. I'm
Shay,
working on it. Since my wife died, I've been messed up, man. I'm just being real. I know it's been 4 years and people think I should be over it, but yeah,
Shay,
you know.
Shay, how
And
Grief
long?
that's
is
why you have
you.
your sickle cell family here.
Shay,
Reach
how long
out.
I've been talking? How long I've been talking about that him and talking more, and it's been a minute.
Yes, for a while, some years at this point. Yeah.
Yeah. I've been
I mean,
telling.
he comes, he joins us though every now and again.
Yeah,
He
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 do.
comes on.
Yeah,
I be in
Yeah,
there. See,
I've been
she
trying
see.
to
I be in there. Look, I be in there every blue moon. You know, like
yeah.
it's
You
like
gotta give him some credit.
I'm like a
You know.
werewolf. Only on full moons I pop out. Nah, but
Okay,
we
that's
do
telling him
need
good.
his voice is needed. I,
we do need more of this though. Like real talk.
Yeah,
Like it's even though I don't do this all the time. Every time I do it, I feel better once I'm done. Like this makes me feel good, and it's a good feeling to actually talk to people that go through what you go through, and have an understanding. And what we need to do is get some younger people in here because a lot of young people. I remember being a child and feeling like nobody understood what I was going
yeah,
through. Like you didn't want to tell people you were sick because then they treat you like you had leprosy, and you couldn't be touched because you're gonna fall apart. But at the same time, being sick, you didn't want people to think to. I don't know how to phrase that, but I don't want people to act like I'm normal, but don't act like I'm not normal. You get what I'm saying? Like
yeah. You don't want the pity. You
Yeah.
just want the
yeah,
acknowledgement of, okay, you're not all the way normal, so we gotta handle you with care. You
yeah,
know, but not pity. I
yeah,
definitely
exactly.
understand that.
Like I want to
Yeah,
play football. Let me play football, but don't if I get sick, don't act like you did that because you're not Superman, sir.
yeah,
yeah,
But yeah, I
yeah,
think we should get some young people involved and just talk to them and get them like coach up our future generations. You know, I don't
yeah.
know, just different
I
things.
definitely understand you. And, I just want to take the time to acknowledge, those younger people. If you're ever watching, or if anyone who does watch this, if you know any younger people who have sickle cell who might want to, speak to whatever subject, if they just feel like, oh, I just need the platform. I'm always, my I'm open to having conversations, to, even if it's a panel that you just want me to provide the platform, that's fine. I have no issues with doing that, because I know, like, there has been times where there was just men's panels on my page. I just set it up, I gave y'all my platform, and I'm in the background if y'all need me, but I'm not a part of the discussion,
yeah.
because those conversations need to happen. So I'm not going to ever say, oh no, because no, like, that's what this platform is here for. In my eyes, I came into this community to unify with other warriors, to, you know, build bridges and connections and collaborations. That's the entire point of my existence in this community. And if I'm not doing that, then
Hey,
I'm not doing
ne-
anything
next
properly.
Wednesday we need to pay you though, cause you pay for this thing. I ain't kind of know that at first. I don't know how this stuff go, but yeah, next time we need to throw you a little something. You know what I'm saying, to put on your yearly.
Yeah, that would help
Yeah,
definitely, because I do come out of pocket, and I am a single mom, so
like we gotta
every
start
little bit
at the
helps.
two. Like people gotta start looking out for each other, and like not just what we need.
How much? How much? How much? How much? How much is it?
It just depends on if I do yearly, if I do monthly. I genuinely do monthly, personally, because I cannot afford the yearly. So monthly, it could be $25-$30 depending on the package. It depends on the package and the platform. Like
How
this
much is how
platform, I
much is
think
the yearly?
um it just depends on the package. I would have to, like, have that conversation with you after I do the research again, because I have all that. I just, off the top of my head, can't
All right,
remember.
just let me know.
Oh, okay, cool. Yeah,
We can
I
talk. We
can
can
do that.
talk about it.
Yeah,
See what we can
definitely.
do.
I'll reach out. Yeah.
See if we can pull some rabbits out of the hat.
And listen, I'm the queen of that. I'll be making it happen, Captain. And I don't know how. Well, I do know how. That's God. But
See, I may not be here all the time. Maybe I can support it being here all the time.
Hey, okay, I heard that. Thank you. And thank you all for watching. Thanks for the comments that you all are, commenting. Nikita, thank you for joining. Like, I really appreciate you all because this is what it's here for. Like, we're supposed to interact with you all and, have these conversations, open up these discussions for people to have these conversations on this platform or not. You can watch it later. People who watch these videos later, a lot of people watch the panel later, and that's fine. If you still want to comment, if you watch it after we've recorded, that's fine too. Like, just go ahead, drop some comments. I typically respond to pretty much everything people comment, unless I'm really sick, but I'm not. So, make sure you're giving us some comments and give your point of view to this conversation that we've had. And if there's any other types of conversation that you want us to have, feel free to comment. Or you can even inbox me and, have that conversation on what you want to hear talked about. If you want to be a panelist, don't hesitate to reach out as well and let me know. Anybody have anything else they want to add to the conversation
And
before
maybe
we
maybe
end?
next we could get a poetry, just straight poetry thing, and Nathaniel participate in that too.
Why you
Oh,
trying to
okay.
set me up, dog? Why you trying to set me up?
I'm trying to
I
bring
think it's a
the
good
best out
idea.
of you, bro. I'm trying to get a community to you that I get.
Yes.
Hey,
We can make that happen.
roses are red,
Definitely.
violets are blue. Don't be setting me up on this interview.
He said, "All right, I did my poem."
Yeah, I'm trying to get him the Nathaniel I know, who got a
You're
lot.
just trying to expose the world to your greatness, Nathaniel. That's
Hey,
what he's saying.
I might have a poem or two to read to myself.
To yourself, how that's gonna help us?
Hey man, that I do it on camera.
Listen, you know them young people talking about. You never know which young person that might hear your poem and it might change something in them. You never know.
That's
Mm,
true. That is true.
Humber. Yep. You should, yep.
Got me later, huh? I already know what you do.
I got your phone number, right?
He gonna call you when it's over. He gonna be like, "Hey, man, listen, don't be putting me on the spot. Don't be putting me on the
He
spot."
do this all the time.
Sure does. Okay, is there anything else? Any projects anybody's working on? Anything they
Well,
wanna?
yes, I wanted to share my sickle cell candles. Chevion already know about them, but for sickle cell awareness, I don't even know if you guys can really even see the design or anything. But basically the label is
Hold your hand behind
nor-
it.
normal red blood cells and sickle shaped blood cells.
I can't
Uh,
read it. The white won't show up, but
okay, well, if they're on my website as well as I also post them, but it's for sickle cell awareness. The candles have the red dye in them. Each candle is different, as you can see, unique for our ourselves because we're all different. We suffer differently. The red represents our blood. But yes, come support
What's the website?
yeah. What's the website?
spoiledpleasures.com.
Who?
Spoiled pleasures.
Spoiled
Spoiled?
I'm
pleasures.
also put it in the I put it in the chat as
You
well.
commented. That's you that commented that. Okay.
Yeah,
Is
Yes.
I
is it
pinned
is
it in the
you?
Hey,
comments.
I ain't gonna lie.
Spoiled
I didn't know
for
who that
you?
was, and I was like, "Why somebody talking about sex in here in these comments?" Because spoiled pleasure sound like a freaky site.
Somebody told me that before, but honestly, I came up with the name because um I'm gonna be honest, I'm spoiled. but also thought about pleasures because I wanted people to experience my different products that I make. I not only candles, but I make bath bombs, room sprays, vegan lip balm,
Yes, that's
a
me.
whole bunch of other stuff. Yes, that's
I'm
me.
sorry. That's just where my mind went. I apologize. I just
So I wanted everything to be pleasurable.
Yes, and I made sure I pinned that site for you, sis, so
Oh,
people can
thank you.
actually go ahead and click on there.
Lip balm like lip gloss, cause I can't have this my no lip like my do
No,
it.
it's lip balm. It's lip balm. Vegan lip balm.
Uh,
Not no lip gloss.
uh,
And if you guys don't know, I'm putting out a special edition to my sickle cell love story pretty soon. You can go and cop the regular book, but the hardcover is
that's the
coming out
freaky stuff.
soon.
See.
That right there.
I don't know what you're talking about. What?
nah, the freak person done got off already.
Oh no, yeah.
Oh.
She. Hey, listen, listen. I was trying to listen. She. I thought she was about to get into the freaky stuff. I was like, hold on, where we going?
Woo-hoo.
Listen, hey,
Hey,
we
listen,
all got something
I
going
mean,
on.
cool. It's cool though that you got like other, like even though they exclude us, you didn't exclude them. Like that's dope. I see you got like the cancer stuff and everything.
Yes, yeah. Well, I also my plan eventually is to with my business is to bring more awareness to other illnesses just besides sickle cell. Cancer is going to be one of them. I also want to do something for suicide prevention. So yeah, I'm slowly making my list of things that are illnesses that I want to promote and help out with, and then
Man, you know that's
eventually be able to partner with some nonprofits so some of the funds can go to research for us or
Mhm.
cancer awareness. You know,
Yeah, that's awesome. Master, you got anything you're coming out with? Anything you wanna
Mm-mm.
explain to the folks? No.
I just be doing stuff.
Okay.
I just be all over the place, yo. I be doing like and telling what I might work tonight on it on these paintings. I'm painting tonight. I ain't painted in it. I've been messing around.
I get it. All right. Well, without further ado, we're going to end this live. Thank you all for watching.
Wait, what's the
Make
slow
sure you can.
I
push?
want to ask Master a question. Do you have like a website or anything for your paintings, or like do you how much you charge for your paintings?
Now I don't have no website. Probably need to get one, but I don't have no website. I really just be doing things through social media, art gallery.
Okay, well I'm gonna hit you up because I need another painting.
All right, which one you have? The one
I
that
have a tiger painting that you did. Well, you
okay,
had already created it, but we were on a live. I think it was through Shabrion as well, and
yeah,
I seen it in the background, and I
yeah.
was like, "Oh my god, I need that tiger painting."
I think Omika got the one I did of um
Diamond.
diamond. Yeah,
Mm.
and then
Yeah.
I gotta make some. I gotta make some prints of the one right here of hers.
I ain't never got my painting.
I got yours over here too. You want to see it?
You, yeah, you finished it?
Uh. But I got. I started it though.
He
I
said
want
I
that Muhammad
started
Ali
it.
painting, man. How much is that?
Did you know that I started it?
Nah, I didn't know you started it.
Uh, uh, uh.
Oh, that's dope. I like that.
I started it.
Talent, look at talent all up in here.
Yes.
Hey, that's Muhammad Ali behind you?
Yeah.
Yeah.
Yeah, man. How much is that? Let me get that out you.
That's going to the gallery.
Damn it! I
Yeah,
can't
they
compete with
charge
those
like
prices.
nah. Listen, but you can get a print though. So
How much
that's
your print is? Where they at? You got them?
nah. I ain't done with it yet. Matter of fact, I might actually call you cause you know when when he wouldn't go to war.
Hey, you know it'd be cool if you put like some graffiti of his sayings around his head,
Of
like
his who?
especially about like the yellow man. He never did me nothing.
No, so that's what I'm doing. That's what hold on. Ooh, let me turn around. That's what uh camera. Nope, that ain't it. Nevertheless, that's what these are. So
Oh, okay.
I be taking like old I be getting like clips and stuff or just like his sayings and stuff like that. And like it's a news clip and then I make them look
Oh,
old.
okay.
Yeah, I
I
make them
see that
look
now.
all old. And then this one
So
down here.
I'm hit you.
But
I'm
I
gonna hit you up about it, dog. I'm gonna hit you up. I'm gonna hit you up because I
Yeah,
want
that's
I want to see.
clean.
you
I want
know
to see
that
that.
one. You know when he was saying like I ain't draft dodging. If I'm gonna fight y'all and all that.
Yeah.
Yeah, so I'm figure out how to put that up in here.
Oh yeah.
Mm.
That's
I'll
gonna be
put
dope.
this stuff all around here. Yeah.
Yep.
So yeah. Then I'll
Yeah.
be
That's awesome.
That's gonna be dope.
Mhm.
I got a lot I'm doing, bro. It just be all
Very.
over.
It's a very talented person.
Ah,
Yes.
brother.
I appreciate
We're
you.
all very talented. We're all, we all have our own lanes, and I love that for us. Like, we can
Mhm.
use those talents to bring sickle cell awareness or to just be great and be an example of what thriving with sickle cell really looks like. So I'm totally like grateful to every one of you, especially, those who are making that valiant effort to thrive with sickle cell, not just survive with sickle cell, because it's hard. I know it's hard, but we do it. So anything else
Mhm.
before I end this with my positive words of wisdom?
Nah.
No?
Dang.
All right. Thank you all for watching. Thank you all for being on the panel. I truly appreciate you. This conversation was definitely needed. And our next Impact Series conversation, I should have one for Sunday. If not Sunday, definitely coming up on next week, Thursday. And we're going to continue to bring awareness, continue to have those hard conversations. Our next conversation is actually going to be on, hold on, I don't want to misquote myself. Uh, Barriers to access with housing, financial stability, and
Ooh.
healthcare with sickle cell. So that's the next conversation. And that's the next panel that I'll be doing because I know that it's a very important conversation. This impact series,
Very.
we hitting heavy, we hitting hard with the topics for the series. So I hope you all join us for our next conversation and thank you again. I will leave you with my positive words of wisdom, which is start where you are, use what you have, and do what you can. Until next time, folks, peace.
Bye.
Bye bye.